catalyst for change with the chance to thrive. Crystal is the one to stir up gifts and save lives. You get exposure, promotion, and marketing too. And advertise for business owners just like you. On Storytime, your interview is global. Virtual or in person, just come on the show. Yo, your story matters. Crystals will open the door. 40 years of experience, ready to give you more on Storytime. Get ready for Storytime. Hey, come on.
All right, everybody, are you ready? This is Crystal. I am so excited to have you here on Storytime. I want you to know that now you can be seen and heard. Yes, Storytime has expanded, and you will be able to see yourself streaming live on multiple platforms. So come on over and get with us and check it out. I want you to go ahead and schedule your interview, and you never know where they might find you online. So, thanks for watching. See you somewhere on the internet. All right, all right. So welcome, welcome, welcome. Once again, we're excited. We're excited to be here with you today and to have this conversation. As many of you know, this is personal to me. This is very personal to me. If you follow me, then you know that you see me share all the time with my sister who had dementia. So this touches home. So when Carol told me this was her area of expertise, I was like, wow, man, this is perfect, man. This is perfect. So once again, we want to remind you to please, please, please be sure to like, comment, and subscribe and share this with people that you know need to hear this because it is going to be a good one, a personal one, a relatable one that is touching many of us. So without further ado, we're going to bring her on up. All right. Definitely. Let's give her a round of applause. Hey, hey, hey. How you doing? How you doing?
Hey, I'm doing good. How about you?
We made it here. We made it here after a full day at church.
Mm-hmm.
So I got a question for you before we get started. Did you bake one of those desserts that I saw? Because I saw quite a few of them.
Actually, I did not. My son Paul, he entered a s'mores fudge actually in the dessert dash. So he got a certificate for best in show.
Oh wow! So it was a competition.
Mm-hmm.
Did you taste some of those different ones? Because I saw a lot out there. I was like, ooh.
I tasted just about all of them, but that was all I could do was a taste because it was a lot.
Wow, wow. Well, we thank you for coming and getting here because I know after eating that dessert and having a good word, it took a lot to reshift and come back and have this conversation. So we're excited. Other than that, you having a good day today?
Yes, I am. I'm having a great day.
Yes, yes, yes. So I did put on a flyer, Dr. Carol Diggs. Talk to us about that because you said, girl, I don't want to mislead the people. I want to mislead them. Tell the people about the doctor because that's exciting because I think you have a
Okay.
role now in a new movie of the doctor. So talk to us about that for a minute. First, tell them your name, who you are, and a little bit about your background and the doctor portion too.
Okay. My name is Dr. Carol Coco Diggs, and I have worked in mental health for well over 12 years. I am a certified dementia practitioner, which is why I'm here to talk to y'all today. I am a mother with a young one who wanted to be a part of the conversation. But aside from that, um, when y'all saw the doctor on the flyer, I have a PhD in Christian counseling along with all my other titles, but not MD, but PhD. So the stethoscope and everything y'all saw in the picture was due to a film that I am in playing a doctor, a medical doctor in that particular film. So we just Crystal grabbed that photo, and it was something to be explained, but nonetheless, I do have the background, I do have the years experience, and I'm here to help you all today get some clarification on some things.
And I thank you for that. And dementia is an ugly topic, Carol. It's an ugly topic for anybody who has had close experience with this thing. It's a monster, man. I thought cancer was something, but dementia, I don't know. I think dementia might be neck and neck because watching what it does and how it does it to our loved ones is something. So I know that you said you wanted to do this in three parts. You wanted to kind of educate us. Tell us how you want to go about explaining this today.
Today, as we start the series, we're going to address what dementia is, what it looks like, and why it's often misdiagnosed. You'll see me check out a few notes here and there because I want to make sure that we get this down and that I don't leave any pertinent information out. Okay.
So the
I'm
so
sure.
the $1 million
Mhm.
question that we're gonna start off with is what is dementia?
Ooh-wee. First of all, dementia is a mental cognitive decline that impairs the brain. That's basically where it starts off at. And during most of my trainings, I show the way the brain progresses as far as, it starts to look nice and juicy when we're, at a great mental state. But as it starts to decline, we begin to see those spaces open into the brain. And it's almost like a file cabinet with missing files as the disease or everything progresses. But Alzheimer's is a disease, but dementia is actually not a disease. It's a syndrome.
Oh wow.
Yeah.
So let me take my glasses off on that. So it's not a disease, it's a syndrome. Explain what you mean by that because um what's the difference between a syndrome and a disease? Let me ask you that.
Okay. A disease is generally something that's incurable, first of all. And dementia is an umbrella of symptoms. So it's multiple things lumped in under one umbrella caused by the changes in the brain. So there's actually about 30 types of dementia out there
Wow. Really?
that most people don't even have a clue about. So it affects your memory, your thinking, your reasoning, your judgment, your language, your personality, and everyday functioning. So it makes it hard to function.
What is one of the first things that a person will see in their loved one or friend or anyone to make them think, okay, we need to get you checked out. You may have dementia.
Well, I'm gonna tell you some of the things that are early signs, but people often miss are repeating the same questions. They may have the same question over and over. Getting lost in familiar places. They're used to going to the same church, been going to the same church, driving there for 30 years, but now the directions are challenged. They're not getting there the right way, or they're losing track of how to get there. They're more dependent on the GPS and, somewhere that they're familiar with. They've been going for 30 years, as an example.
And you know what? That happened to me. And the funny thing was, I remember telling my cousin, because I would say, man, I get lost. I use GPS to go places I go all the time. Or when
Mhm.
I forget stuff, the mind will play tricks on you too as you
That's
age.
true.
So I'm approaching the 70s. All right. The next group for me would be 70s because I'm over
All
65.
right.
I'm over 65. I just turned 66 last week. So as I start to do things, she said to me, girl, ain't no wrong with you. You just getting old. That's all. That's the part of aging. So how does one really distinguish between aging and between those symptoms? It's tricky, isn't it?
It's very tricky, and that's why it's most often misdiagnosed. But another thing is difficulty managing money, personality changes, increased irritability, poor judgment, withdrawal from social activities, trouble following conversations. I don't know if you've ever been in a conversation with someone and it started off one way and somewhere in between there was a disconnect, and that you that you were speaking clearly, or that they should have caught it, but they didn't quite get it. They didn't connect the dots. And suspicion and paranoia are another thing, because sometimes people misplace things and they think that somebody stole from them or they took it, when in fact they just, misplaced that thing.
I think I hear that one a lot about them accusing people of stealing. I think
Hmm.
that one must be a very popular one. So is it something uh it has something to do with the brain cells? Is it damage to the brain cells in some kind of way?
It does have something to do with the brain. We have not figured out exactly why these things happen. Some things are hereditary, other things are, once again, we found out that it mimics depression, or it
Wow.
mimics anxiety, thyroid issues, vitamin deficiencies. Believe it or not, low B12 and things like that can also make you think that that person has signs of dementia. Medication side effects also cause memory loss and cognitive impairment for a time. So there are so many different things: grief, trauma, sleep deprivation. All of those things take a toll on our mental health and our brain, and dementia falls under a mental health issue as well. So one of the issues in our culture is that we delay evaluations even though we know something's not quite right, and the mental decline is generally not discussed. Families hide symptoms sometimes, because like you said, we think it's a normal part of aging, and it's absolutely not. There's some people, believe it or not, 100 years old, sharp as a tack.
Yes.
So, and the caregivers compensate quietly, and doctors don't screen enough. They just don't.
So how did you get into this field? Did you have a personal encounter with someone who had dementia?
Initially, I didn't. I was working for a company, and still is, called Therapeutic Alternatives. And with my company, we teach and educate on mental health issues. And we were given the opportunity to be certified as dementia practitioners, because we were already teaching and training at family care homes, nursing homes, helping administrators and various people, nurses in the profession, get their certification or keep their CEUs, which are educational credits, in that area. And it was funny because, like I said previously, I had been working with seniors in geriatrics anyway over time, and this area of dementia kept coming up. But I noticed that later on, some of my family had dementia. Excuse me. And the dementia actually turned and progressed to Alzheimer's disease. And Alzheimer's is a completely different beast of its own. But yeah, so like I said, you never know what's going to be the route you get to where you're going. but I've learned that everything is starting to have a purpose, and me even being able to educate people today is one of those.
So does everybody who have dementia eventually get Alzheimer's?
Those who live long enough, depending on what form of dementia they get, makes a difference because some is less progressive. And then we have to look at age, like I said, hereditary genetics, things like that, also determine the progression because I've actually, okay, well, I better keep that to myself, but I've seen some members of the community that were not necessarily that old, really, with dementia that led to Alzheimer's. And by the time it was all over, they passed away and they were much younger than maybe their 80s or even their late 70s
Wow.
because
So
once it
there's no age.
progressed, right, exactly.
So it can happen to someone in their 40s and their 50s and their 60s. There's no certain age. Wow. Is there a cure?
Unfortunately, there is not. They have come up with some medications that slow down the progression or are said to slow down the progression, but not as of yet. There's no cure as of yet. And sadly, what happens is, in a caregiver situation, there definitely needs to be some additional education there. And we'll get to that because caregivers get burned out
Yes.
through that progression. You know about that, through
Yes.
that progression.
Yes.
Yeah.
Yeah, because it's a thing where sometimes people, I think they're in denial, or you really don't know. You're not educated about it, so you don't know what's happening. You don't know what's happening with your loved one. And I remember when I first started seeing it, I started reading. So I think it
Mm.
is important that if we think something is wrong, that we educate ourselves some kind of way. Ask questions with the doctor or read or do something so we can make sure that we can help our loved ones because it does become very challenging. And I don't think anyone with dementia can maintain it without some type of medicine to slow it down with the brain because I noticed that as it takes effect, as it takes over, Cal, it's like a thief in the night. It's like a
Mhm.
thief in the night. Sometimes when I look at my sister, I use her for example. Sometimes when I'm with her, I'm sitting there with her and I'm like, I be wondering, what is she thinking? Where is she at?
Right.
Because they seem so distant that it just takes them on a ride. It's like it just takes their mind, it snatches it. It's like, oh my goodness, that's scary to watch.
Well, it's scary to watch, but also when it gets to the point where, they no longer realize what life they had, what career they had, what children they had, or who they were married to, and different things like that. That's when it gets very, very painful and triggering for the family members, especially.
Yeah, and I be saying, Lord, I'm grateful that she still knows who I am. When I come there, if there's
Mm.
a new nurse or something, she'll say, "That's my sister." So I'm like, yes. So she still knows who I am, and I can be sitting there. Sometimes she'll be quiet, and then she won't really engage with me, or she's looking at the TV. But I'm like, does she really know what she's watching? And sometimes I'll ask her and she'll respond, but I know that she knows she's watching the show, but she don't really know what's happening in the show. You know what I mean? It's like she
Right.
can tell you what channel she had because she can see it, so she can still read out Bravo.
That's
But
good.
yeah, so she'll say, well, ask because one of the things we do, and you can tell us if this is good, if we try to make a talk. We ask a question to engage her. Like we don't just let her sit there and not be engaged. I try to always keep her mind going. I'll say, hey sis, look at the pictures of the baby. I just came from here. And she'll say, what's that? So I'll try to keep her engaged. And I can see that she's fighting. She's fighting
Mhm.
to stay engaged, to stay connected. Is it a certain level of dementia or a certain phase where they just stop fighting and they can no longer, hold on? Because I see her holding on. I see her saying, I'm gonna give this thing a run for my money. And I'm always saying, Lord, this girl is the champion.
Mhm.
But in the bottom of my soul and in the back of my mind, I'm saying, dang, how long is she gonna be able to do this?
Right. Yeah. It really depends on the individual. I mean, I think she's definitely a wonderful fighter and trooper. Just watching her through everything that she's doing, I think that she is hello. I think she's doing a awesome job in just being able to manage everything. And it's hard because you're trying to remember things that you don't remember. It's a memory impairment.
It is memory. And we have like one of those digital cameras that so we used to do like puzzles and books, but she no longer reads. She was reading, and that was good. And I tell you what, I still actually work today because with my job, it's evolution, so it's always changing. And I'm trying to keep my mind active because I said, listen, I was told if you keep your mind active, then that's good, because a dormant mind, that's how it can snatch you too. So I said, okay, I'm gonna keep my mind active. So I want you to talk about that too. But the biggest thing is with the pictures, right? Sometimes she'll see certain things. She'll be like if my mom and dad picture come up, she'll say they're gone.
Hmm.
So she recognized that our parent, and she recognized they're no longer here. She'll say gone, they're gone, you know. And then if it's a picture like of us or something, she'll say, look, she'll look. So certain things trigger her and give
Hmm.
her an emotional connection, I noticed.
Yeah. And like I was saying, the brain is definitely like that file cabinet. So there's certain files that are sharper than others and different memories that she'll remember. And like you say, the photos, the music or whatever are great triggers of often happier times. And it helps to jog their memory about certain situations and things that have occurred throughout their lifetime. But there are those areas that are empty or
Yeah.
getting somewhat empty, cloudy, and that they don't necessarily remember anymore or not as well.
It is safe to say there's areas that I guess the brain doesn't send a signal, like, so she doesn't have or want to get up and walk anymore. She doesn't want to
Mhm.
move around and do certain things, and so I know they say that the brain sends signal about everything we do is happening in the brain. We're eating, losing your
That's
appetite,
true.
stuff like that. I know that as I have watched people transition from life to death, I know that in the end phase they stop eating. And I was
Mhm.
told that that's because a message in the brain is stop saying you're hungry. You don't know that you're hungry anymore. So this thing with the brain, have you ever heard in your years of working with this of anybody beating dementia or reversing it in any kind of way by using any kind of natural remedies or anything? I mean, by the grace of God, just a miracle. Have you ever heard of anybody that just kind of reversed it?
I'll be honest, I have not. I wish I could tell you I have, but I haven't. I mean, we've seen people, even with the best of care, the best of money, the best of doctors, celebrities, and so forth, that unfortunately, like I said, they may have been able to delay a few things, but they're still going through the progression of it. So
Wow.
yeah,
So you said
not
it gets
yet.
missed. Not yet. Well, we're gonna claim that it's gonna happen. Somebody gonna be the first. So how
That's
does it get
right.
misdiagnosed? You said sometimes it gets misdiagnosed. How did that happen?
Yeah, it gets misdiagnosed because a lot of people are one ashamed, that these things are occurring, number one. And also, like I was saying, some mimic dementia by being vitamin deficiencies, IUDs, oxygen loss, heart failure, those type of things that impact the oxygen getting to the brain has a delay in the way people remember things, and depression, trauma, grief, all of those things. It's like, you're in a fog, you're going through the motions and you're not making those connections during those times. But thank God that if it is not dementia, it will pass.
Right, right.
So
So are
that's
there
a good
certain
thing.
questions we should ask? I mean, how does one, like, besides going to the doctor, how does one know what questions to ask. Like, suppose these people have some of those other conditions you mentioned, right? Because it gets tricky when you
Mhm.
have multiple
You're right.
conditions and something else starts to happen. How did the person juggle that? How do they know the difference?
I think I think internally, I'm not talking about outside folk like family and different people, but internally, I think the individual kind of gets a clue or a signal. They know when they used to remember things and now they don't quite, know it, or they need more notes, or they need more assistance in trying to remember things and put two and two together and things like that, and it can become overwhelming. So even in that regard, if you notice some of those things, you definitely want to ask about cognitive screening or a more in-depth doctor's visit or appointment, because generally when you go, you're not going for this unless you're going to a psychiatrist or something. You're generally going for physicals and things like that, and they may ask you, how you feeling today? Are you depressed? Have you withdrawn from activities? Those kind of things. But sometimes
Is that with
family
a
also,
neurologist? Would that be with a
neurologists, yes.
neurologist? Okay.
Yes, that's good too, because they can actually see what's going on in the brain and be able to tell, if things are starting to look a little bit different than a normal brain should.
Yeah, so that's who we went to her. Of course, you start out with your primary care, and then the
Mhm.
primary care does what they do, and then they send you on, like you said, for the cognitive test. And there's a whole series of things that they do, and it's tricky. So the
Yeah.
caregiving part of it, it does take a lot out for the caregivers, knowing how to stay connected. I try to post a lot on my platform, sharing just little things I find, like how I try to always touch my sister and give her a hug and kind of still let her
Mhm.
feel me, because I feel like if her mind is slipping and she's fighting to be present, at least if I give her a touch, that it brings her back somehow. Is there studies or something that says the physical touch really makes a difference for people with dementia?
Physical touch is good. Um, Also, when knowing how to touch is also important, because if that person has had some kind of trauma or molestation or something like that in their history or in their past, that can trigger off a completely different wave of emotions and problems. So you also need to, at best, know about your loved one. I mean, we don't
Yes.
know everything about about everybody, but do your best. And even in that regard, one of the trainings that I do with staff and different things is to teach them how to approach a senior or a person living with dementia, or on that cognitive decline spectrum. You want to not come from behind, but approach them somewhat from the side or peripheral and even from the front. And then be very calm and even tempered when you speak, and take your time when you speak to them, because they're trying to catch up to your words. But if you're speaking your normal, fast talk or whatever, they may have caught a portion of what you said, but not the rest of what you said. So that's important.
Take your
And
time. Okay.
don't just grab and touch. Like, we have something called bathing without a battle. So when things get to that point where you have to start bathing folk and things like that, you need to have permission. I don't care if they have dementia or whatever. You need to kind of signal or and even tell them what you're about to do. And you may
Okay.
say, well, they don't know what you're about to do, but yes, they do, to a
And you
degree.
know what? I'm glad you said that, because one of the things I'm learning is that in these facilities, they respect their boundaries. They will
Mhm.
not do anything if they don't want it. And it could be something they need. It could be they could need a bath or they could need to be changed. But if they tell them no, they may have to call us, because they'll be like, listen, this person needs this, but they
Mhm.
won't let us do it. But we can push them, But in these facilities, they will not push them because they said they have the right to say no. And I don't always like that. That's not always good because sometimes it'd be like if it's for their cleanliness or something, like there should be a rule where it's like you can override. I mean, how do you
And
feel
see
about
that's where the training comes in at, because they have something called residence rights. And there's a right to refuse, a right to the route in which medication is given. There's so many different rules in that regard. So even though it may be necessary that they get a bath or that they take their medicine as a staff member on the opposite side, they're not allowed to force or push in that regard. Now, if they've been properly trained, what they can do is wait and come back, come back, and there's certain techniques, even with giving a bath and everything.
try a different
Yeah,
approach and try to,
exactly.
to get them to agree and, like they say, kill them
And
with
try a different
kindness.
staff member,
Yeah,
because
okay.
maybe this
Mhm.
person isn't the one that they that they want to
That they
do it. So,
trust. Right,
hmm
right.
hmm
You're right. And so you're right, because I know with my sister, there was one particular person that she tended to always be able to get her to do whatever she needed to do. If somebody
hmm
else would say, well, I couldn't get her to do a shower, but there might be another person, they'd be like, you know what, they can, they know how to reach it. They have a personal relationship. So I think building a relationship with
hmm
them is good. I think in 2026, I'm seeing that because of the short staff, because people are overworked and underpaid. Sometimes people are on these jobs for just a paycheck. But I have to say, I've been meeting some people lately that really genuinely care, and they're really trying to go the extra mile to do what's necessary to try to reach them and help them. So that's a blessing, because overall, about a year ago, before we got to this place we had, that was not my experience. So, um, and I even had to report it. I even had to report it because, and that's how I found out about the fact that they really, regardless, they will not override their decision. Like they have the right to say no. And I said,
hmm
but if somebody's sitting there in their fetus or something, and you can smell it, you can see it, you mean to tell me you just let them sit there in it? Like that to me is ludicrous because it's not safe, it's
right.
not healthy.
And it's not sanitary. You're exactly right. Now that's the point where you do need to contact a family member or someone who's on their chart and their paperwork, and see what we can do in order to push this along.
Yeah, and sometimes I know, and that's not always my sister, but I observe this with other people in the places. And I know sometimes you have to increase medication because sometimes the medicine
hmm
helps to control their agitation and calms them and makes them more cooperative. So that's deep, man. So there's stages of dementia, huh? So is there any
hmm
forewarning for a family member? Like, how do we know like when is the next stage?
Once again, like I was saying, it's progression, and there are different parts and different. Let me see. I don't want to miss nothing. First of all, we want to, like I said, make sure that it's not interfering with everyday life. If it is, then we need to get evaluated. We don't want to guess, we don't want to assume, and we don't want to cover things up. If there's an issue, of course, we need to address it and see about screenings and things like that. But one of the other things, and I'll go back to your question, but one of the other things that we must do, especially with a faith-based background, we
Hmm.
pray and we definitely want miracles,
Hmm.
to happen and to occur. But even in waiting patiently for that miracle or what have you, still go to the doctor and get those tests done and those things checked on, because a diagnosis does not remove dignity. We still want to treat the person with dignity. And it does not mean that you don't have faith. It does not mean that you do not believe in God, or, that thing, or that you're not strong enough. It just means that you need a little bit more help on this side,
Yeah, yes, yes, yes.
So
And
Yeah.
you know what? When you talk about the help, um, respite care, hospice, there are places that will come in and help you if
Hmm.
you are just burnt out and you just can't do it anymore, and you can't put them in a facility and they're still in the home. You could use some of those places. A lot of time people used to think, for instance, hospice was only for when people
Uh-huh.
were at the end of life. But I found out that hospice will come in and help you before that. And then I
They
found
sure
out
will.
about respite care. So, do you think those are good resources that people should use if they are in need of additional help if they can't do it by themselves?
I think absolutely. It not only helps the person that you're caring for, but it also helps the caregiver because that's someone coming in with the training and the experience that often becomes a sidekick, if you will, to the person in the home or the person that is doing that long distance care to help calm that person down, to help assure them that, things are going to be all right. Often it's more to that person that's coming in to assist from those agencies than just medical. They become like family before it's
Yeah.
all over, before it's all said and done.
Now, I will say this too. If you see that somebody's going through this, you probably want to start to have communication with them to help managing their affairs, because if you see the decline starting to happen, you need to do it while they can still share information with you, while they can still tell you things they remember, because if you wait too late and if you don't get your name on those papers, there might be a problem. Is that correct?
That is definitely correct. If you start to see any progression or what have you, even before that, go ahead and get those wills checked, get those trust and paperwork and things done because from experience, there's nothing worse than being in any medical emergency or situation and you either one don't know what's happening, don't know what had happened, or the paperwork is not in order. And during those times, that's not the time when the person is mentally or physically capable of going down to these places to get those documents signed. And once things start to happen in that regard, lawyers and so forth will not allow you to get those things done because of any diagnosis or any symptoms and things like that.
So it's almost like you have to do it while you're healthy before anything happens. It's like we
That
have
is
to have
it.
these conversations with our children before we get sick, before you see a sign or a symptom. You just have to have those things in order, you know. And that's why I also wrote that book. I think that's a good time for me to throw in a plug too. That's why
Go
I
ahead, tell
wrote
me
this
about it.
book, Final Wishes: A Transition from
Uh,
Life to Death. In this book is where you can actually
mhm.
leave instruction for your children. You could tell them if you want to be resuscitated or you don't want to be resuscitated. You can tell them your insurance policy information, because a lot of people are not going to do the wills. A lot of people are not going to do the fancy stuff. So this is something easy. It's just something you can fill in. It's a book. You can get it online for $10. It's the best $10 you can ever do. Because I'm going to tell you something, in my opinion, from my experience, learning what somebody's final wishes are and carrying them out is a lot easier than
Mhm.
you making a decision to pull a plug, because now you're the bad guy. You know what I'm saying? When the doctor says we can't do anything else, and you're there in the room, and everybody's standing around, and people are emotional, and people are like, no, you know, give them more time, do this, do that. Well, if it gets to a point where you can now say, listen, this is what mama wanted. Now
Mhm.
they're not looking at you like, how dare you? Now it's like, okay, we're honoring their wish. So that's where the important discussions come in. So I just want to throw that in there because it's so important. If you leave a comment, I'll let you know where to get it. But it's on Amazon. Again, it's called Final Wishes: A Transition from Life to Death. If you put my name in, Crystal Bodie Smith, then you'll find it, because there are other books out there. But now when we go back to
Mhm.
the dementia, one of the things that I also noticed with my sister that was very helpful was structure, having routines.
Mm-hmm.
The routines gave her something to look forward to. It's like she was like, okay, we're gonna do this today, are we gonna do that? So uh is that a proven thing that a structure helps them?
Yeah, structure, routine, because yeah, they do have something to look forward to. And even we know that even with mindless behavior, if we do something over and over and over again and we're used to doing it, we don't even have to think about it. And that's whether your mind is clear or not. You know, you just you just do it anyway. So there's definitely nothing wrong with developing a routine. Is actually a great thing.
And now you brought up a point that really I never thought about what you said when you said it. Know what the person has gone through, because if they are agitated, if you go to grab them or to touch them and they don't want you, you really might have to know what they've been through, because that might be a reason for it. So that's deep. That's deep. So outside of having a routine, learning how to
Mhm.
communicate with them, talk about communication for a moment. So they're repeating a lot, right?
Right. They're repeating a
People
lot.
should not be agitated, be like, you said that already. Why do you keep asking me the same question over and over? So people have to exercise some patience, huh?
They definitely have to exercise patience. And once again, if you don't know, like say for instance, this is the beginning and you don't realize that that is what's going on with that person, then yes, you get frustrated. And sometimes the grace goes out the window because you don't know that you necessarily need to give them any.
Yes, 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 yes. So that's where I'm going to suggest you need to know your history, because you heard her say sometimes these things are hereditary, right?
It can be,
So if you
yeah.
know that there's dementia in the family, like grandmama had it or auntie or something, and you start to hear somebody do that, you might just want to ask some questions and
Mhm.
just start to pay attention. Also, Carol, I know for me, my sister was living by herself,
Mhm.
and I started to see some stuff when I visited her. A lot of time people are busy, like you said, we have to be nosy, and you don't see it. They won't tell you because they have pride.
Mm-mm.
So you have to really listen and watch, and you have to know your people,
Yes.
because they may not tell you, and you have to follow your instinct. So I followed my instinct, and I said, no, we got to
Mhm.
go to the doctor. Something is wrong.
If
And
you
for me, it
also,
worked.
you probably seen this too. You go, you buy groceries. You go in and you knew how much grocery you bought or whatever, and you're like, did they eat today? And you're noticing maybe there's some dishes around, but the food hasn't been opened. It hasn't been eaten. You know, that kind of thing. So it's like, wait a minute, why do you still have this? I bought this 2 weeks ago.
Yeah, yeah, and it's not easy, guys. It's not easy because for me, um, they're private, and sometimes they won't want you to touch their stuff. They don't want you to go in the refrigerator. They don't want you to look in their stuff. But when you see something, you just got to ask questions. Be like, you know what? Come on, let's get it checked out. And I'm just encouraging everybody to do that. For me, it was the same thing with my sister when she had brain surgery. Her brain was bleeding, and it was like
Mhm.
I was like, something ain't right. She was falling, and she was doing some stuff. I was like, we got to go get checked out.
Yeah.
And when I went and got her checked out that night, they had to do brain surgery.
Oh my
So
goodness.
I want to encourage you, if you're watching this today and you think somebody in your family might have dementia, they're asking a lot of questions, they're getting lost, they can't manage their money, like you heard her say, find a way to just take note, and then find a way to get them to the doctor. Is that what you would recommend? How would you recommend somebody try to get answers if they see this happening with their loved one?
I'm gonna tell you exactly what I have. What you should do when you first notice changes is document what you're seeing. Write down specific behaviors, dates, patterns. Then schedule a comprehensive evaluation. Documentation helps the doctors to see the full picture of what's going on during the course of a day because symptoms don't always show during short appointments. So if you're bringing that person to a doctor's visit and you're expecting the doctor just automatically agree that they are having these symptoms, 9 times out of 10 they won't display those symptoms during that particular visit. So you need to document. And also, if cognitive or behavioral changes begin interfering, like I said before, with daily functioning, then it's time. So you don't want to wait until it's severe. You want to work on that now because it could affect their safety, decision making, finances, and independence. So early evaluation provides clarity, and clarity reduces fear. That helps with the fear factor. And just in case, if it may be an older adult or a parent or someone, you want to lead with care, not correction. Saying you're forgetting things or I've noticed some changes and want to make sure you're okay, then people are a little more receptive of that than, oh, you're forgetting things. Oh, you don't remember this, and that kind of thing. That's more or less combative and accusatory to the other person. So we want to make sure that we do that because partnership in their care is the goal. Not all that extra
So in
behavior
other words,
that's
don't
generally
attack.
emotional.
Yeah, so in other words, don't attack them. Why you keep asking me the same thing? What's wrong with you? Mom, you said that earlier already. So if that happens and they do that and they come in and they ask you the same thing continually, then what you need to do is simply let them know that you notice something and it's concerning to you and you'd like to address it. You simply let them know that you'd like to address it because you've been taking notes. You might say, Mom, Dad, can I share something with you? I've been kind of taking notes of some things that have been happening with you lately, and it's kind of concerning to me. And so if you do that, that might be the way that you can do that. If you let them know that it's kind of concerning to you, then we can do that, you know. So that's what I would recommend. That's what I would recommend. And so I hope that you got something out of this today. I really, really do, because what we wanted to do today was talk about adult care beyond medicine, because it's not always about medicine, it's not always about taking them to the doctor, but understanding how to take care of our loved ones. We must know how to take care of them, you know. And so I'm seeing that Dr. Diz may be having technical difficulties. So if we have to bring this to a close, it's okay, because she gave us a lot of good information to go with, because sometimes we have to just digest a little bit at a time. And we're going to go into more because as we're getting into a stage where we're taking care of family and we may want family to take care of us, we need to know how to communicate it. Once again, if you're just tuning in, I also told you I have a book, Final Wishes, Transition from Life to Death, and just put my name on it, Crystal Bodie Smith, and then you can get it. And that'll be the best way to do it. The best way to do it for sure. So I definitely want to thank Dr. Diggs for being here and doing everything that she did, because it's been very informational. It's been very informational. It helped us to understand what we need to do. And I want you to come on back. We're doing a series. We have a young man that's helping us with finance. We have a young man that's helping us with healing out loud. We have Dr. Diz was talking about adult care beyond medicine. And what I say, finances, healing, adult care, and prepared mindset. Prepared mindset. We're called a retired law enforcement officer. So we're bringing you some things here. And then we also have a young lady that's a yoga enthusiast. We're doing yoga with her. So not only are we doing stories here on Storytime, but we're bringing you people to give you good information. So we hope that you'll come back again and see us again. And tell somebody about our channel. Once again, this is Storytime Podcast with Shal Crystal. And you can follow us. Okay, Storytime is where stories are shared. Okay, and we want you to know that your story matters too. So let us know. Join us, and we want to thank Dr. Diggs for being here. We look forward to seeing her movie that she's going to be in, or if it's a movie or a play where she's going to play the role of the actual doctor. We look forward to that. But again, she is certified in this area, so she was very qualified to help us, okay? I want to get out of the way. I want to remind you that we have some great shows coming up for you. We're going to be doing quite a bit this month, honoring a lot of people during Black History Month. So stay tuned, and we'll see you on the next story time. My name is Crystal Bodie Smith. I am your Hope Catalyst. My mission is to stir up the gift, instill hope, and save lives. That is what the goal is for me. And so with that being said, we just want you to know that we're here. We just want you to know we're here. We want you to know that we know it's not easy. You've seen me sharing it. I share it because I know it's not easy. I share it because I've had people come up to me and say, thank you, Crystal. Thank you for showing me how you cope with this, because some people are coping with it by themselves. So that's why I do what I do. So I want to let you know you're not alone. You can send me a message. There are community groups out here you could join a community group, but get support however you need to get it, okay? I love you. Keep hope alive. Be encouraged. God bless you. Have a good day.
A catalyst for change with the chance to thrive. Crystal is the one to stir up gifts and save lives. You get exposure, promotion, and marketing too. And advertise for business owners just like you. On Storytime, your interview is global. Virtual or in person, just come on the show. Yo, your story matters. Crystals will open the door. 40 years of experience, ready to give you more on Storytime. Get ready for Storytime. Hey, come on.